Hello, I'm Eugenia Foxworth. Welcome to the Foxworth Theory. Thank you for tuning in to this week's podcast. If you're just joining us, you are now tuned into the Foxworth Theory. I'm your host, Eugenia Foxworth, and we have one of the most interesting guests, Dr. Hassan Tetteh. Now, welcome back, Dr. Tetteh.
Thank you.
Thank you. If you could change anything that we're doing now in our communities concerning the pandemic, what would it be?
Not have the virus exist. Well, in seriousness, that's a very good question. If I could change one thing, I think, it's important to understand and appreciate. Again, in the previous segment, I talked about being this student of the pandemic, this pandemic, of course, and previous pandemics. I think the one thing that I would change, if I could, is a conveyance of a perspective that everyone should have. And what I mean by that is, this is a very challenging time. There's no question, right? It has impacted the world in both very, difficult and challenging ways, right? No matter where you are in the world, this has been disruptive to you. The one thing that I would like to change, if possible, is to help people understand how they should perceive what's happening, though. And what I mean by that is not in a conspiracy way or anything like that, but just for their own personal edification. And think about, and you will really appreciate this, think about this moment that we are experiencing as a once in a lifetime moment, the pandemic, and focus on how you are going to evolve as an individual during this time. And everyone has been given, to some degree or not, the time and space to think about that, right? Whether you've been impacted by it, by losing a family member, being sick yourself, being concerned and afraid of being sick, or watching everything on the news and thinking to yourself. You started the program and the engagement today by asking me, how am I doing? Right? And that was a very deliberate question, I'm sure.
It was.
And my answer was very deliberate as well. And that's how I would come back to answering this question about what is it that I would like to change. And that is the perspective that people have for this moment in time that we're experiencing. That I think they should look at this as an opportunity to evolve. And people have done that by circumstance. Some people have done it intentionally, and some people have had to do it just because of design. So if you think about the fact that you are here and you're living through a moment where there's a lot of danger, there's a lot of angst, and there's a lot of concern, but you're still alive and you have your health, think about how you can now reimagine and sort of reinvent yourself in a way. Whether you lost your job or you still have your job. Now that you're at home and you have a little bit more time to think about what it is that you critically wanted to do in life, this would be the time to sort of think to yourself, all right, what are the steps? What are the things that I'm going to put in action and in motion to make that happen? And that's a counterintuitive way to think about things, right? Because you can certainly sit in your home or wherever you happen to be and be in this woe is me sort of mentality, which won't be very helpful for you, certainly not helpful for your family or your friends, and not helpful for society either. Or you can think to yourself, hey, wait a minute, I've survived, I'm healthy, or even if I've survived and I've overcome being sick, I'm still here, right? And now is my opportunity to make the most of what life I have ahead of me. If nothing else, you should think about this, especially here in the States for us, that there are over 1 million people who are no longer with us right now because of COVID. And I lost family members. I've seen patients that have passed away. So each day reminds me that the fact that I'm still here and I'm above ground and I'm living, Eugenia, that's my moment. That's my time to now say, hey, let's not waste today thinking about what's going on, but let's use this moment. Let's use this time. Let's use this experience right now to grow and evolve. and to think critically about what is it that I wanted to do in life that I've been putting off? What is it that I wanted to share with a loved one that I never shared with them before? What is it that I want to do to take my relationships to the next level? What is it that I want to do to take my professional self to the next level? What is it that I want to do to become the best version of myself? Like, use that time and take this, all of this experience as a way to appreciate the moment in time that we're living in, you know, and evolve from it. So that's the one thing that I would like to change in you know, with this whole thing is the mindset of how we're experiencing this time. And then I'm gonna, and then I just want to give a little bit of context. And you might say, well, this doctor sounds a little wacky. Why is he talking about this? How could I think about all these great things when so much bad things are happening? And that is because you have to understand that humans are very resilient. We are a powerful people and we overcome many things. This is not the first time we've had a pandemic. It won't be the last, Eugenia. But if you look at what happens after pandemics and you look at humankind and how we evolve outside of pandemics, great things have come out. Great art has come out. Great technology, great innovation has come and emerged from pandemics. You look back to what we call the Roaring '20s. That was after the Spanish flu. There's so many reasons for why there was this industry, this great growth, this great productivity after that time, because there was this pent up desire for people like now to say to themselves, wait a minute, I'm still alive. I have an opportunity to make the best of the rest of my life. And I'm going to do that. I'm going to take advantage of that. Let's go back centuries before that to the Black Plague. That was a devastating time in history. Do you know what came out of that? The Renaissance. Think about what great art came from that, great literature, and how that evolved and influenced everything that we're doing today. So I hope that answered your question, but that's the way that's the one thing I'd like to change, is the perspective and to reframe how we think about what's happening to us during this moment in time, and understand that this has happened before, it will happen again. But take confidence and solace and faith that humans are resilient people. We are a powerful people, and we have the ability to take circumstances that may seem very challenging and hard and difficult, and turn them around to make them better for ourselves and ultimately for society at large.
You are speaking to the choir, because I too have pivoted. And when I say to people, you know, it's a terrible time. However, I'm making the most of it in the manner in which I can do things, not just for others, but for myself. And, you know, it's like looking within yourself and what you're saying. You are really an amazing man. And my listeners will now, I know, 100% agree, but I do appreciate what you are saying. And it is so true. And I believe that that's what everybody should think about, you know? You can't put off today for tomorrow. I'm sorry. You can't put off the day for tomorrow. I lost a friend and I kept putting off. But we had time to talk before he got COVID. He got COVID after he went to the hospital for something else. So I know this. I don't feel guilty because that person's here, but also for myself. You never know what's going to happen. Now, it's all about you. You are well educated. We all know that. And you have studied at the State University of New York. What was that part of your life like growing up?
It was foundational. It was life changing. I mean, that's quite frankly what it is. You know, I think people have this cliche of saying, "Oh, education it changes your life." It really does. It gives you, I think, what I would say, opportunities that you would otherwise not have. And for me, I've always loved learning, and so my first sort of university level experience of learning came at the State University of New York, a small little arts and science college in Plattsburgh. And then I had the great fortune of going to a medical school also within the SUNY system. So the State University of New York has been a great provider of education for me, and something that has given me a foundation upon which to build upon and get other, educational experiences under my belt. But it's really, at the end of the day, opened up the world to me and doors of opportunity. And I always encourage anyone that's even has an inkling of taking the next step in whatever their educational career is, whether you're going from, middle school to high school to college, high school to community college, high school to trade school. Learning is what we need as humans to grow and to evolve and to become better versions of ourselves. If you're not learning, then none of that is happening. You don't always have to do it within the institutions of colleges and schools. You can learn within a library. You can learn by picking up a book. You can learn by listening to this conversation right now, but you have to be open to that. So it's a long-winded way of answering your question, but you also are asking someone who loves school. So I'm going to always say that all day long. I love learning.
And I'm also learning a lot myself. And you're a very positive person, which I am as well. It's just, I'm probably enjoying it as much or more than my listeners. No reflection on the listeners, because I don't know who's out there, but I'm enjoying it. So this has been a selfish conversation. Now, what do you miss most about those days?
Oh, the days of learning. Well, I don't miss
Now,
too
being
much.
at the university.
Oh, being at the university. Well, I guess I guess the camaraderie, because I will say that some of my best friends in life were made at school, whether it was college or grad school or med school. The friends that I have to this day have been friends that I've met and encountered in some sort of educational environment. I have friends still from high school. In fact, I was just having a text exchange with one of my friends from high school. And so if you think about high school, for me, it was decades ago. It's been the school or schools, and certainly universities among them, that gives the environment and the community to develop these very long lasting, very special relationships that are lifelong and life changing in every way.
And that is definite. That is definite. Um, Now, was your father and mother supportive of you becoming a doctor? I know your mother was, from what you said initially, but what
Yeah.
about your father?
Well, yes, he was in his own way. My dad was a bit of a stoic person, so he was a man of little words. He didn't say a lot, but his actions and the times where he did speak were very impactful, and also very influential. It's not lost on me that I know that you, in your own way, you're an artist. You espouse the arts and you bring that to life in what you do in your work. And when I was leaving high school and going to, actually before I even got to the university, and before I even came to, be in my high school, I considered myself an artist, and I would paint and I would draw and I did graffiti art, primarily back then. And I got into a very prestigious high school for art. And I went to my dad and I said, "Hey, I want to go to this art school." And he said, "You're not going to art school. You're going to science and engineering school because you're going to be a doctor." So, you know, that was a way of influencing, or sort of like, directing me a certain way. Now, I've never left or abandoned the love that I have of art. That is still part of my DNA. I bring it to my practice of healthcare. But yeah, certainly, I think both of my parents wanted me to realize uh, my potential, and once I expressed to them that I wanted to be a physician, they made it possible, I think, by the encouragement to see that, be, made to reality, or come to reality, I should say. So yeah, they both were very, very influential. And I think, my dad unfortunately is passed now. He actually passed away after I graduated from med school, so many years ago now. I think, but his illness and it's me seeing him suffer through chronic illnesses, only emboldened and sort of empowered me even more to want to, do it even more. When I say do it, become a doctor even more. It was a more powerful burning desire, because I wanted to be able to help others, as I saw him suffering and not necessarily thriving. So.
And I can understand that. Now, I know you mentioned your mother and father. You didn't mention any siblings. Are you from a small or a large family?
I would say, well, I think a lot of West African families are fairly large. So yes, I have lots of siblings. I have a fairly large family. Yeah, and then absolutely, like every, I think, family, there are all kinds of dynamics. For the most part, I am very fortunate and blessed that I've been able to be supported by my family. My family members have contributed immensely to my life, and I've been now fortunate to have my own family, in terms of my wife and my children that are now growing up, and they have, I have a son and a daughter, so they'll be growing up with the, their sibling rivalry, but also their sibling love, for the rest of their life. And I think that's a great thing to see, and sort of, be a part of the cycle of life here is a good thing.
Thank you. I live vicariously through everyone. Though my parents were divorced when I was 5 months old, I have no siblings. So I just attach myself to families and I enjoy that. So I have a variety. Now, you are also the founder and principal of Tetra Consulting Group. I'm curious as to what that is now that you've had this entire conversation. Could you tell our audience about the Tetra Group and how did this come about?
Yeah, well, I can tell you how it came about. When I was in business school, one of our projects was we had to start a company. So that was the company I started. That was with that. So it was very simple. That's how that came about. We had a project. It was like you had to start a company. That was the company I started. But what it has become actually is a number of things. First and foremost, it's a consulting group, and if you've been engaged with any consultants, the consultants consult. And you might say, well, what is that? Well, they help individuals achieve their goals. I think essentially, if you think about any consultant, that's their role. Whether you're, sort of a consultant in healthcare or you're a consultant in business, you're helping your clients achieve their goals. And that's fundamentally what Teta Consulting's principle and sort of modus operandi is. That's our MO, is to help people achieve their goals. Now, it happens to be usually in the domain and the sector of healthcare. And over the years, what I've done is I've given speeches, I've given lectures, all to help educate folks within the healthcare community on how they may achieve their goals, and actually sometimes how they may help formulate their goals. And that's evolved into writing, into books, and to, as I mentioned, lecture series, and actual one-on-one coaching with individuals that need or are seeking some direction in terms of how they can sort of list their priorities and then get after the action steps that they need to fulfill those objectives and achieve those goals. So that's in a nutshell what it is, and it's now it's evolved into many things. A publishing company, we provide services to folks. We again, educate individuals and communities, and actually even have one-on-one engagements with very influential leaders. So it's been a very rewarding endeavor. At the end of the day, we're really here to help people.
But that's what you are all about. Now, you are the author of the Art of Human Care book series. You practically answered the question.
Right.
I was going to, say, well, okay, tell me about all these books you've written. You're a best-selling author of several books: Gifts of the Heart, Star Patrol, and the Art of Human Care. I feel dumb asking you, where does this passion come from? You've said it all, but
Yeah,
there may be something that we've missed.
I think you said it all. I think it's all a matter of serving. And I've had a goal, I think, throughout my life to teach, to heal,
Mhm.
serve, and to lead, and all the writings and the books and the things that we do, or I do, I would say, sort of on a day-to-day basis, are all aligned with those objectives and goals.
Okay, now this is my last question, Dr. Tata. What do you want people to know most about you and your mission to help save lives?
Well, I think it's definitely been espoused in different ways throughout the time we've been talking here. I think what I would like people to know is that my, you know, greatest desire is to be an inspiration to others, and help them to realize their own goals in life. And I want, the things that I do, the work that I do, the writings that I put out, to be informative, to give information to individuals, and to help them in a way that sparks something within them to say, ah, I see a way for me to prioritize my own goals, and I see a way for me to achieve those goals. And at the end of the day, I'd like to be a catalyst for people getting to where they want to be in life. Because I think in that way, it's a very rewarding experience, and it's a way that one can say with great confidence when you look back on your life that you made a difference.
And you have done so, and you've made a difference for our audience and for me as well. And I'm sure that you're all over the internet, so our audience can Google you and follow you as I have done recently. And I would like to thank you, Dr. Hassan Tetteh, for being on the show. And I want to thank all of our audience for joining us on the Foxworth Theory. Thank you for joining us on the Foxworth Theory. Be sure to tune in on Tuesday at 9 p.m. on the Foxworth Theory Network.